Welcome to UnHypnotized. I'm thrilled to announce our official sponsor, QuickBit Crypto Boutique. QuickBit is a Bitcoin first company specializing in hardware wallets, seed storage, education, and all things Bitcoin. I know a lot of you are concerned about the safety and security of self custody, as you should be. So, when buying a hardware wallet, it's important to buy from a manufacturer or an authorized reseller. When purchasing through Amazon, eBay, or other marketplaces, you can't always be sure who's handling your product. QuickBit is listed on the manufacturer's websites as an authorized reseller, and they handle the product directly and ship it in a verifiable, tamper proof bag. QuickBit's also owned by my good friend Dale, who actually orange pilled me, and he's a wonderful person to do business with. I highly recommend checking them out. These are real Bitcoiners running a real business. Welcome to the next episode of Unhypnotized. I'm True Heather, and I am here to have a conversation with Emma Apatu. And, Emma and I, we met in Victoria at Learning Bitcoin. And right from the moment that we started talking, we knew that we could sit down and have a conversation around health, Bitcoin, money, and how those intersect, but also what health might look like in the future with sound money. So, Emma, thank you so much for being here. Can you tell our audience a little bit about yourself as we get started?
Sure, but thanks. Thanks so much for having me here. It's wonderful to connect again. And so I'm Emma Apatu. I am part-time associate professor at McMaster University, and I specialize in the social determinants of health and health education. So that's essentially health promotion. And in 2021, I came across Bitcoin as a tool for financial empowerment. I believe that Bitcoin can provide people the ability to build that foundation for health. While money itself doesn't naturally afford you with health, but it can give you a lever to buy the things that you need to support your well-being. And in 2021, when I discovered this, I kind of had to take a step back a little bit from my academic role, and I started Dream Grad Academy. It's an educational platform that works with people that are on the early stages of their Bitcoin journey, who want to learn about, what is Bitcoin, and then also how can they self-custody Bitcoin as well. And so, yeah, I'm just a Bitcoin advocate looking to just share the message of Bitcoin to beginners, particularly women, and also just anyone that just wants to uplift their financial future.
I know. We're excited to have this conversation. And it is almost inevitable when you find Bitcoin. I think it's inevitable when you find Bitcoin that you want to share it. And then all of a sudden, I found myself pivoting to be like, okay, let me help you get set up. Let me help you have this. And when you were saying that you saw how money plays that role in health, I could really attest to that because being somebody that healed myself from my asthma and my eczema, I paid a lot out of pocket to get the right support. Like I really didn't have it much use for any kind of the free healthcare in Canada or even some of the subsidized by insurance. So I think that this is a topic that will really resonate with our listeners from all around the world because even though everyone might have different access to health, it does become the responsibility of the individual to seek out the best support for themselves and what they're going through. And, when we were talking earlier, you were speaking about how there's that we weren't always in this type of centralized health system that we're in now. And I'd love for you to share some insights around that.
Yeah. So prior to the 1910s, healthcare was a lot more decentralized. There's a landmark paper known as the Flexner Report that's essentially talked about this kind of scattered medical kind of care system, if you will. And from that point, um, essentially, medicine became more centralized. And in addition to that, medicine also kind of removed the doctor from the bedside in some ways, or less patient doctor interaction. We know that that's a critical point where the doctor can really, assess symptoms, signs, allow the patient to communicate. And also, medicine also became more reliant on science. Don't get me wrong, we definitely need science in our medicine, but a lot of it started to hinge on this laboratory clinical sciences. And we've had many remarkable breakthroughs from this. But I would argue that, unfortunately, in some ways, it has created a system of medicine that perpetually funds research that is that focuses on certain areas. And as an individual, um, if your health condition kind of doesn't fit in one of these broad pockets, then that means there may not be a lot of funding for your health issue, and the sciences may not be researching it to a level that it deserves attention. And, in some cases, that's just an artifact of that's maybe a rare condition. And, we have to economize. And so we can't, research everything. But unfortunately, in some ways, we if over science things sometimes. And so I think we saw some of this during the pandemic that it was all about following the science, which we indeed needed to have. But it seemed like, in general discourse, we weren't able to really debate the science. And I think that's where um, uh, uh, things kind of go wrong in some ways. Like, for example, there was the Great Barrington Declaration during the recent pandemic that argued for a more focused control approach because the secondary consequences potentially could be worse. You might see more mental health issues, for example. And we're definitely seeing a lot of that. And we are also seeing that children, particularly, were not at great risk. But then all of the science that was being pushed, I think showed some other trends. And I think our messaging during the pandemic got very politicized. And I think this all has roots again back into this push into this kind of clinical kind of sciences of healthcare. And again, this is speaking mostly of the West, kind of like pivot to this real credence in clinical science. And I would argue that well, clinical sciences are great, and when we look at a lot of these clinical sciences, they rest on epidemiological studies. And if you are a individual looking at some of these findings,
Yeah.
they may not fully apply to your individual case. And so there's something called the ecological fallacy, where you have findings from studies based on groups, and then you falsely apply that to the individual. And so I think, for Bitcoiners are very, for example, trust but verify. Like they really look into the evidence and see what that means for themselves. And I think for, general public, we need to be thinking more along these lines of looking at evidence and around what it means for the individual. I understand for, broader public, fact to look at the general side of things. But yeah.
Hmm. Yeah, there's a couple things in there that I think are really good for us to unpack, because coming at it from this softer approach, that was a very nice soft delivery of what happened. And I am a huge fan of the softer approach because it does create a more fertile space for curiosity and learning. Like, as you were speaking, I was really hearing how, right, like some of these systems are just designed to kind of help the greatest amount of people through these struggles, and is just inevitably going to leave out the individual. But the individual can, verify and then trust or take in what sounds right or resonates with them. And as you were saying that, I was thinking about one of my favorite quotes from the book Dark Nights of the Soul. And it speaks to healthcare and when somebody is really going through a challenging diagnosis or an illness, but even just in general, I think this speaks to the human desire for our doctors. And it speaks about, if only my doctor would just take 5 full attention minutes and hear me and what is ailing me and what I'm feeling and what I'm going through, um I could really trust their response or their reply that they would give me, or their inquisition could even help me learn about myself. And when we're looking at, a health journey, whether it is healing from illness or just moving towards optimal health, there's a lot of aspects that go into health: mental, emotional, we could call psychological, spiritual, physical. There's so many aspects that go into health that, would you say, in that sort of centralization of decentralized health, that there has been a, a loss of treating the whole patient or the holistic person?
I think so. I think to an extent, yes. The body is a microcosm and functions with all of these various parts. And our medical system has kind of chopped that up and divorces each of the systems from each other. And you might be having, a problem that's, aching you, let's say, in your knees, but really it might be your diet, right? Maybe you're having a very inflammatory diet. And is your let's say physical therapist or your orthotic doctor, are they going to be asking you about your diet? Well, if you have a really good one, I think so. But I think, with some healthcare training or medical training, there's not a great attention put on nutrition, for example, right? And we know that a real root cause. And so, yeah, I think we have kind of, we've separated the parts of our system when we are this whole, which doesn't make sense. But I think when you have a centralized system, they have to have a service model in some ways, and it's been chopped up. Is that the best way? Mm.
Yeah, I mean, that's where we're going with this for sure. And I just remember when I was really in like the depths of healing my asthma, especially, that was the most challenging. And I'd always have these conversations where my doctor was like, no, you need to take this corticosteroid. But then every time that I took it, sure, it would help me breathe. And I had a lot of conflict with it because it would help me breathe. But then it was like starting again with my lungs working on their own. And there was always like this period of real tiredness. And we would get in these conversations. Like I was doing a lot of healing with whole foods at that time, traditional Chinese medicine stuff. And she said to me, Heather, like, I don't know anything about that. I took 1 day of nutrition in my entire course of becoming a doctor. And I was really thankful that she told me that, because then I stopped looking to her for that information and then just went to people that knew that information for that information. And so I think the reality is like really good to just understand that is one part of a way to find health and healing. And this leads me into something I've been really loving to talk with people and Bitcoiners with, which is the system, and how Jeff Booth in Victoria, actually, on his presentation, he said, you can't change the system from inside the system. And, as you were saying that, I was thinking about how, right, like that's one system of kind of treating symptoms separately in the person. Like we'll give you this we'll take care of your kidney like this. And then if there's another side of effect in your body, we'll take care of this. And so I wonder, do you think that we can change the system from inside of the system, or that we need a totally new system?
Oh, wow. That's a very loaded question, especially when it comes to healthcare, this vital resource that we need in our societies.
Yeah.
And, I don't want to come across as, this person bashing, our current kind of medical systems, because I think we can maybe point to some positive aspects, I think, which would probably center on the people, right? The nurses, the doctors, the carers. Generally, these are very hardworking, good people trying to, care for people. And I think if we could take those good people um, and um, pair them with empowered, I think, people and patients that have a sound money system, that are storing their value in Bitcoin, I think that will help us find the best solutions. So I think, you know, for example, as Bitcoin takes over, we hope it wins. Um, I think people are going to spend their money where they get the best results, right? So I think that will force the economic market of medicine to compete. I mean, or at least we would hope so. Um, and so I think a new system will emerge from that. I think um, we would have a more decentralized system that would provide people with more choice. But I think, again, it will have to start with the people, with empowered people. And I think we're already seeing this today in circular economies where Bitcoiners are, they're supporting their local ecosystems, whether it be their butchers or their physiotherapists, or and I think it's these circular economies that we're going to see some really interesting health impacts coming out of this. And I think the healthcare providers that see what's happening in some of these communities, are going to want to embed themselves there. And then I think we're going to see, other medical providers that are going to want to provide infrastructure. I think there's some really neat things happening in Bitcoin in healthcare. My colleague, John Gordon, shout out to Satoshi Health Advisors. They're helping healthcare providers adopt a Bitcoin standard in their health practices. And I believe he also is involved in another initiative called Nos Fabrica that's allowing people to own their healthcare data using Noster. And so that's a new system that's emerging. And I would argue that's reflective of, I think, the organic process that Bitcoin fosters through choice, through innovation. And I think it will bolster new systems.
Yes. Yes. And right, Bitcoin is innovation. And I love, first of all, how you humanize the people in allopathic medicine, the people that are just genuinely there, signed up because they want to make a difference. They're like me. They had felt like a real calling to help other people heal, to help people through their hard times. And as you were talking, it made me think of some people that I know that, would love to do the work they do, but be able to make more of a difference. And just working with many healthcare providers over the years and, their own dark night of the soul, so to speak, sometimes when they recognize that they weren't helping as much as they could and they started to kind of see what could be better. And then they're becoming innovators too, some of them even in those hospitals and in those schools. And when we think about, which I think some people watching maybe haven't yet realized about Bitcoin, but this is a community full of people creating solutions for a better planet, for a better humanity, for a better community. And, even at our conference at Sovereign Minds that we just had here in Calgary, I came away from it going like, right, like we all want each other to be well. And we're all like supporting each other in our wellness and our success in a sense. And, when Bitcoin becomes more widespread, like you said, people are going to vote with their money. They're going to pay for what they want, what serves like their health or the community. And then the money printing machine, has less power because right now, if you can just print money and then allocate it to the areas of health that, kind of that greater whole of like, this is what sort of the leaders or the people in charge want to see in our healthcare. The people are voting with their own dollars in terms of paying for things that they want outside of that or even sometimes inside that. But there's still a lot of top down power. There's still a lot of like authoritative kind of top down where we're still not getting as much of a say through the way we use our money. And I know you got some things to say about this.
Yeah. So like I really appreciate Manuel Takano's definition of kind of like what is money. It's the lifeblood of society, right? And if it is broken, that means our health, the overall health of our economy and ourselves is going to be anemic, right? Money represents our purchasing power, our ability to interact or transact with one another. It's a price coordination mechanism system. And so if you only have, a group of people controlling this for everyone else, then that's really going to kind of distort the system. And, we were talking about, reimagining kind of the healthcare system and, we're mentioning people, the nodes in the system. Really, I just really would hope that we can see more healthcare workers, public health workers realizing that Bitcoin is this tool of empowerment. Like we're seeing so many, I know in Canada, there's so many strikes, for example. We've seen like nurses, doctors, shortage of, you name it, many care workers. And they're asking the system for more and more money, but that's the same toxic blood that is going to just, make the system sick. And so we need to, back to your other question, kind of create this new system that is built on a pristine foundation, on fertile soil, so that people can thrive again. I do think we will need, our safety net programs. We will need government to some extent. Because if we think of what government is, it's people organizing themselves and coming up with policy. So we will need that to a degree. But I think it would probably be less. And we could then from there truly develop policies that meet the individual and community needs. So I think once again, healthcare would become a lot more localized.
Hmm. Well, and then the different modalities that serve people's healing and health could work together.
Yes. What a breakthrough.
But everyone I know, that's all that they really want. Like, why do I have to send my tests to the States? Like, and it's true. If that, I think that's why people get frustrated, because it's just common sense. Like, it's just common sense to go like, so I can't get this test done by my doctor because that's not allowed, or that's not been brought into policy in this system.
Yeah, I've heard of that. Again, my colleague John Gordon does a great job of talking about sort of the misalignment of incentives in medical care, so that there's this critical agent problem, right? Where you have, the provider that has an asymmetry of information, knowing the kind of treatments that can be offered and so forth. And then you have the patient that has the information about themselves or symptoms and all of that. And so there could be this misalignment that happens. And then you also have kind of this third party, if you will, of insurance kind of,
Mm.
deciding what payments. So imagine if we could reduce a little bit of that third party and bring the patient and provider together on, a more even plane. Um, and that patient could hopefully more clearly maybe trust also what the provider is going to be offering them, and the provider can be providing recommendations that's maybe more alignment with that patient, right? um yeah.
Well, and then the provider would be more fulfilled in their work too. I really believe that, because the providers are often feeling unfulfilled in their work as well because of their restrictions, time restrictions, even just like solution restrictions. I always give shout out to some doctors along my way in my career that would recommend their patients to me because they just knew that that wasn't something they could help them with. And there's nothing wrong with that. That's also when we take the ego out of medicine and healing and healthcare too, because there's nothing wrong with, like, one person could not have all the answers, could not know. And then especially if they're specializing. So I think if they could also um be more involved, we could say even low time preference, or like being more focused in that sense, like being able to look at the person or work with the patient as a team, and really investigate or work together, like, you know what I'm saying, but really, like, I don't want to get it into too much of a utopian in this sense, because I think, sure, that sounds great, but as it is right now.
If I may add an additional point to what you're saying, is that again, we're all energetic beings as well. And I think we could also resonate and, use our intuition as well to engage in a conversation. So imagine if there was more of that energy there, right? Like that that low time preference to really be in that healthcare engagement. Like for example, medical errors, major cause of morbidity and death, right? When we talk about health. And it just could take that 1 second of pause or presence to really kind of think through what is happening. Many healthcare providers are burnt out these days, right? They don't have the time in some ways to really, provide that patient care and also pick up on that energy of what patient is really saying, right?
Yes. Yeah. And even the training, like I've been thinking about this too, ever since having my panel, Health Sovereignty Starts in the Mind. But really, we were exploring these ways that presence and, really having a model of self-care for also healthcare workers. Because over the years, I dealt with a number of clients that either had been healing from the trauma of malpractice or the providers being so burnt out, having to be really, really motivated to fit any bit of self-care into their work schedule that is put upon them. So they don't have any say in their work schedule. They're not often being provided for with their breaks, their time, their needs. Yet they're kind of, and they're also, if we really think about like working with others in this space where, they're going through a lot, they're sick, they're traumatized. They also need time to, you know, they need ways to like brush it off, let it go, not take it on, not be burdened by it. And so again, when we come back to this like holistic model, we're not just saying, here's what we need as the people. We're saying, here's what the providers also need as people.
100%. Yeah, I was part of a research team looking at burnout levels among public health. So, public health workers, again, are looking at kind of systems, ways in which to protect health. Most people would, recognize public health from the pandemic. But essentially, again, public health is what we as individuals do as a society, as organizations, as governments. Um, it's all of these collective kind of actions that we kind of take on as at these individual levels. I might underscore that makes up public health. And we found that in this study that, a considerable amount of public health workers were, burnt out during the pandemic. Kind of not a surprising finding, but I would argue if we had a more healthier population going into, let's say, the pandemic, this could also have, alleviated some of the burden on healthcare workers and allowing them to have more time to recharge and, really be ready for those patients that really need or clients that need care.
Yeah, that's a really good point because we're only as strong as we are. Like the resilience, or sometimes I even think about spiritual power. In shamanism, I was learning a lot about spiritual power and the more that charge your spiritual power, like the more resilient you are. But this is also physical power. This is also psychological power. This is emotional power, because this is like the more sound we are as humans, of course, the more we can help, the more we can offer. And I've been thinking a lot about this sort of what Dave Bradley calls the Cobra effect. And anyone watching can go to his Bitcoin Brains on X, because he's been doing a daily series about, how Bitcoin fixes everything. And he did it at the conference and it was awesome. But, this Cobra effect where basically they were hiring bounty hunters to hunt cobras in India. And then as there were less and less cobras, they started like farming cobras so they could like kill the cobras and get the government money. But what they really didn't think about beyond like killing the cobras was the after effects. So it's like you were saying, when the pandemic, they really focused, they really narrowed in on this one aspect of health without looking at the potential cobra effect of like mental health or of like how vulnerable were people from the fear and the stress and these other factors that weren't actually taken into consideration for health. And so just like these cobras where they like ultimately had like a massive cobra problem because then they had to stop giving the subsidies for the cobras because they realized people were farming them for the money. So then they had more cobras than they had started with, bringing in this policy. And I think sometimes that's where that presence and just really when you're looking to solve a symptom, looking deeper. And this is an area I'm really passionate about because I truly believe that for ourselves, symptoms are a thread that we can pull on that will take us directly to our healing. And too often, if we're in any type of holistic health or allopathic or any traditional, whatever it is, too often we're still looking at the symptom and instead of, following the thread, taking the time, being curious and looking to what the symptom has to offer in terms of healing and to also prevent, more cobra effects.
Yeah, and I love the fact that you brought up that example. I think it's pure kind of economics, right? Like if we tend to look at the goals of an intervention or a program, but we have to think of the second, third order, impacts or, symptoms of that kind of policy decision. And, for, government, they're not necessarily maybe thinking about all of that because, they're working on these 4-year cycles and, they want to get reelected. And so the goals are the things that we hear. The goals sound great, but what is the impact going to be, 6 years from now, 10 years from now? Are we going to have more cobras? um, I think we need to think, deeper.
Yeah. All I heard is like, oh, right. So then we actually need to change the whole political system.
That's another can of worms. But Julie, I think with Bitcoin is going to kind of reshape a lot of things. I think it was is it like The Sovereign Individual, that book kind of like talks about, the emergence of the digital age and what cyber money is going to do and, kind of the reduction of government and yeah.
Yeah. And now I'm thinking about, right, because so many people are interested in Bitcoin right now because, woo, we're all time high, baby, every day. And so there is a lot of interest around Bitcoin right now. And I find that even in, conversation, just people to people, peer to peer conversation, it's still kind of on the surface of, yeah, your money can make a lot of money. Or how do I buy this? How do I get in on this? So I'd love it if you could share because there are quite a few people that watch us that are new to Bitcoin. And I'd love it if you could just even expand a bit more on that, how Bitcoin is so much more than a financial investment.
Yeah, I think it goes back to kind of economics. Like for myself, I'm not an economics major, but like when you start going down the Bitcoin rabbit hole, you're kind of forced to learn about, economics, kind of what is money, and it can lead you down, various places. So just at a very fundamental level, we all need money to, buy the things that we need to sustain our lives, right? Um, Money helps us overcome the double coincidence of wants, right? So if I have apples, you have cows, how do we go about trading, right? So money serves as that intermediary, and you want money to be something, that's durable, recognizable, verifiable, divisible. And so if money is also not able to store its value through time, so its money also functions so as a medium of exchange, store of value, unit of account. If money is not able to keep that store of value function, then that means that your money is essentially deteriorating over time. And because money is, again, I refer to it as this lifeblood,
Mm.
if it is failing, then our ability to communicate, to trade with one another, diminishes. And this has great impacts to society. So previously, we've had sounder money, we've used gold, and there are cases in history where you see cultures built on strong, sound money. And, in some respect, there was more beauty, um, there was more time preference there to build a stronger society. And unfortunately, today, our money, it's losing its value, it's losing its ability to serve as this price mechanism. And so our money today, we know as fiat money, money by decree, is not able to withstand the inflation that is used to kind of keep the whole thing going. And inflation is one of the most insidious and destructive forces in society. So essentially, you need to address that. And Satoshi Nakamoto knew this anonymous inventor of Bitcoin. And so I think he wanted to find a way that we can heal society through as a sounder money. And Bitcoin is meant to be sounder money. And because, again, money is this foundational thing, a good money should be able to support society. And so that's why many Bitcoiners say that Bitcoin will, fix the world. I don't think it will fix everything, but I think it will create a sounder society and provide opportunity for the billions of people, for example, that do not have access to sound money. Um, so I would say that's kind of a way to sum it up a little bit.
That's a beautiful summary, because when we're looking again at a solution, not just the symptom, we do want to look at something that is inherently, intrinsically for the health and well-being of everyone. And Bitcoin is for everyone. It's not, oh, if you're closer to the money printing spigot, you get more. It's not, okay, we'll allocate this to our friends or to our people or to, it's really something that offers us an opportunity to, like you said, really heal the world. And well, Bitcoin might not fix, still got to do the dishes or change the dirty diapers or, you know, go through whatever challenges you have to go through in life. I think it could fix this type of, like, rushed, burnt out society, like rushed, burnt out healthcare workers, rushed, burnt out moms, dads, people, because I think that the fact that our money is losing value so fast, there's no incentive to store it, but then it also just keeps us having to keep going, keep going, keep going, and not take that pause and potentially sit with ourselves or sit with presence with someone else and really hear what they have to say, or for ourselves and really listen to our innate wisdom that is just perfectly designed to guide us step by step to our health, step by step to our healing, step by step through our fears. And when we have that moment, then we're also more open, right? We're more open to hearing others. We're more open to listening, to really listening what people are saying and, beneath the words. And I actually just started a 15-day series of posts on X yesterday about this, well, really, it's a hypnotist guide to orange pilling. And and it unfolded in this way because there's a lot of conversation on X around orange pilling and a lot of people feeling very frustrated that people aren't open to Bitcoin even when it's pumping. And I started to think about, what does it truly mean to have a conversation with someone? And so I started talking about, you know, how you could, instead of trying to convince someone of what you think is right for them, how can you allow the noise to settle and their own wisdom to come through? Because I really believe that when people have that time to sit with themselves, to feel some discomfort, to see what's not working in their life or their body or their community or their world, it is inevitable that they'll start to find the solutions in themselves. And I think it's inevitable that they'll get to Bitcoin on their own. And so I started to post, and then I was talking in the Orange Sun space last night about it, and they asked me, how do you do it? So I went over like a few steps. So I'm going to start to include that, like really these steps to what we could call hypnotize, but it's really just holding space for presence. And it's connecting with someone to really see, how they feel, what their struggles are. And then if it sees fit, oh, this actually is one way that Bitcoin is a solution. And sometimes, like, I found, I don't even talk about Bitcoin because once they get there, they go, "Oh, what's that Bitcoin thing?"
No, I love that. I think intuitively, many people feel something's off in the world,
Yeah.
right? But may not be able to place like what is off. And I think, if people can get to that stillness and think about, maybe the incongruencies that they're seeing in their lives. Like for me, it was, you know, being a director of a graduate public health program and really just thinking about what public health is and thinking like, why are things going so crazy and awry? It led me to Bitcoin in some strange way, you know? Um, and I just think just people need to open up their minds a little bit and maybe also think about like maybe you've heard of this Bitcoin thing and if there are these negative like connotations that's being held in their mind around Bitcoin to kind of question it. Why is it? Like, did I form that opinion or was that something given to me? And did I just hold that as my belief? Like, try and maybe question that. have the time to, kind of reflect and think about, maybe why do I keep hearing from my aunt about this Bitcoin thing, right? Like maybe there's something there.
Yeah, I was talking to a Bitcoiner recently about this, where I said to him, like, we were talking about how a lot of Bitcoiners are healthy. And I said, why do you think that is? And he said, I think because the Bitcoiners have really sat down and thought about things. And they've really thought about even maybe what health would mean to them and like what that would look like and, what they feel is healthy and versus say what they're being told or what even other people that are healthy are telling them. And they've really taken on that role of like thinking through things themselves because I think when you find Bitcoin, and there is so much to it. It's so nuanced. There's so many layers. There's so many different people in the space. And then there's many misconceptions about Bitcoin. I think that's why it's just been so natural for me to embrace and then speak about, because that's how people were about hypnosis and hypnotherapy my entire career. They're just always coming in with the myths and misconceptions still now because of where they're gathering their information or what they've heard, seen, or been told before. And so once they start to realize, oh, wow, this is a real possible way to become free from within, it just starts to, their view of it starts to completely unravel. And I think whenever we're really courageous, like I do think that there's a courage involved in taking that time to look at what's not working, because that can be heavy. That can be hard to see. It can make you angry. It can make you sad. It can make you frustrated, especially if you feel like you've been victim to um, a system or a process or a doctor or a relationship, anything that really wasn't for your best interest. And I think that's where I would always recommend people maybe get support, right? If they're having a hard time just seeing everything that, may have caused harm in ourselves or in our world. And that, that light of hope, so to speak, that Bitcoin can provide that, okay, yeah, things aren't perfect. But there's a lot of things growing in the light. There are a lot of people, a lot of programs, a lot of services, like a lot of companies, a lot of communities that are growing in the light of Bitcoin.
Yeah, it's just a matter of kind of changing your perspective and a whole world can open up. Um, so I think, yeah, the more and more people can kind of open their minds, especially in healthcare and public health, I think we can start, building this better world.
Mm-hmm. Thank you, Emma, so much for having this conversation with me.
You're welcome. And again, thanks for having me.
Yeah, and if you'd like to tell people anything that where they can find you or anything that you'd love to share with them, go ahead.
Sure. Yeah, they can find me on X through the Dream Grad Academy account. It's a website as well, www.dreamgradacademy.com. Also, we partnered with bitcoinmentor.io. And this is a educational company headed by BTC Session. Some of you may know him, one of the leading Bitcoin educators in the space, and Mike Cook, the business manager, successful business person. We have a whole team of Bitcoin mentors that can help people through their Bitcoin educational journey, from getting Bitcoin off of exchange, using non-custodial exchanges such as Bull Bitcoin, to hardware wallets, multi-sig vaults, running a node. There's a whole team of us that can help. And I particularly work with beginners who are, just trying to wrap their head around Bitcoin. Maybe they've opened up their mind a little bit more, want to start buying, want to start self-custodying, maybe wanted to start thinking about some inheritance planning. So bitcoinmentor.io is a place where you can find me and also a team of people ready to help people along their Bitcoin journey.
Beautiful. I'll definitely leave those links below as well. And so in closing, any last words or insight you'd like to share with everyone today?
I would just say that Bitcoin and health go together. There is, I think, a lot of opportunity for decentralization in healthcare and public health to happen. I'm really excited for this future. If you are interested in discussing this further, I'd love to chat because, as mentioned, I'd love to connect with more people in the healthcare space that we can bolster our healthcare and public health systems.
Yeah, it's not just theory, it's solutions. It's
Exactly.
change, it's innovation, it's education, it's evolution, it's revolution. Well, thank you again for being on it, Unhypnotized, Emma.
Thank you.
Thank you for watching. Remember to hit the subscribe and turn on the notifications so that you'll know right away when we have a new episode with another great guest. And if this episode got you wanting to buy Bitcoin, reach out to me. I'm an agent with Bitcoin Well, and I have a link down below to book a time in my calendar. And simply just book a call with me and we can get you started buying Bitcoin. And don't worry, no pressure. Let's have a conversation and see how Bitcoin can improve your life. Ciao for now.